Then there is the temporal lobe, for example, which is partly responsible for your ability to recognize sounds and also has a role in speech. So again, all different parts of the brain all have different functions. The structures are different for these various parts of the brain, and therefore disease or damage to any of these different parts or structures of the brain could lead to a change in function. The show that I wanted to reference, This Is Us, some of you may have seen it. If you haven't, I don't want to give a portion of it away, but it did recognize or introduce mild neurocognitive disorders as an illness that one of the characters initially developed. And some of the hallmarks of mild neurocognitive disorder is, for example, the beginning of some memory loss, maybe some difficulty recalling names, for example, more of a tendency of the person to misplace things, not be able to find them, beginning to show some difficulties with language, searching for words. Again, this is not the same thing as senility. This is generally something that could progress to a dementia later. But in this case, it is an illness that has now been brought to the DSM-5, and it's meant to recognize what some challenges might look like for someone before they meet the criteria for dementia and or a type of dementia, for example, Alzheimer's. So I want to move on. Got a bit more here to cover. So I do want you to know a little bit about these different types of impairment. I think that they're important to think about, again, in terms of function. Think about impairment of orientation, for example, number 2. And if you are oriented, and most of the time you probably are, you know who you are, you know what day it is, you know where you are, unless, of course, maybe you're very sleepy or something, maybe when you first wake up. But otherwise, you are oriented to who you are, the place, the time, the date, etc. And people are familiar to you. If you're not oriented to any of these, you are likely experiencing an impairment of some type. And this is one way to determine, or one way to see that you may be struggling with a symptom of what could be a brain injury of some type. And of course, there are other causes too. I want to get into more of the clinical picture now, shifting out of dementia, getting into delirium. So delirium and dementia are not the same thing. Again, dementia and delirium are not the same thing. The treatments for delirium are different than the treatments for dementia. Generally, a delirium is an acute illness, meaning short duration. And their causes are quite different than the causes for dementia. So let's get into these a little more. It is the state of, as you can see here, a brain failure, and it is not generally a diffuse failure of brain function, but it is not as focal or as localized. For example, there are some things that can cause this, quote, brain failure, and it can, for example, show itself in your level of consciousness. There's a lot. I'm trying to say a lot here all at once. So again, it is a type of brain failure. It is acute, though, meaning it is generally short term. One of the things that it causes is sometimes the person is of course they're conscious, they're awake, but they are very delirious. They are not making sense when they're talking. Their behavior is very erratic. Delirium can also cause someone to fall into a stupor. That's another word for saying largely not very responsive. They're alive, but they're just not very responsive to stimuli, to things that are happening around them. Not responsive to conversation, for example. Or they may, for a period of time, slip into a coma. So again, delirium is not the same thing as dementia. It is a different illness. And dementia generally has a longer progression and is chronic. People, on the other hand, do and can, not always, but they usually recover from a delirium. Not the same thing for dementia. It is generally a sudden onset, meaning it is not always easy to predict. It can lead to extreme confusion. The person has great difficulty in concentration, and cognitively they're just not functioning well. This can occur to people at any age. That, again, is a major difference between dementia and delirium. The elderly, though, are at risk, and children are at risk for delirium as well. And we'll get into, I'll talk about one of the causes right now. For children is infection, especially very, very high fever. You may have witnessed this in perhaps maybe a relative, a niece, a nephew, a son or daughter, etc. When they were young and they spiked a very high fever, they may have been acting in a rather bizarre way or been very confused. That was probably the result of the fever. But it can also be triggered by drug intoxication and also withdrawal from drugs as well, or head injury. So it is, as you see here, it is different than dementia. It is a true medical emergency. You do not want to pause and see if the person is going to get better. It can be reversible, but you have to get them into treatment. You have to get them to an emergency room, for example. It can be treated with medication as well, depending on what is causing the delirium, and that's important to identify it. But again, it is a medical emergency, but we talk about this in this chapter because it is a brain disease, and it has an impact on, it can have an impact on behavior. Some of the, now I'm kind of switching back a little bit, back to dementia. These are some of the other features in dementia that we really didn't have as much, I didn't weigh into as much, but I want to now. Some terms that you may hear, for example, are aphasia, can be difficulty speaking, and people tend to develop that over time. That is usually not one of the early symptoms of dementia. Apraxia, difficulty with movement. Again, this is generally later in the stages of dementia. Person will begin to have difficulty with mobility. What you're seeing in the beginning are cognitive deficits around concentration, ability to learn or remember how to do tasks, for example, or short-term memory. Over time, there is a disturbance in executive functioning, meaning it is much harder for the person to plan activities, to carry them out, and the deterioration, if you will, continues, and it has a forward progression. Also, you can see changes in mood. You can also see changes in personality, as I said earlier, and of course memory impairment. So again, this is specific to dementia. This is not typically what you're going to see, at least not as much of this with delirium. You may have the confusion, and you will see the confusion, for example. You will see them struggling to make decisions, but it is not the same thing as dementia. Switching back now, getting back into Alzheimer's disease a little more. Some of these things I've already talked about. It is a type of dementia. It is progressive. It does cause deterioration of certain types of brain tissue over time. There is both age and genetic factors as well. You are more likely to develop dementia, specifically Alzheimer's disease, later in your life. It is unusual for it to appear in middle age, but if it does, it is actually sometimes more severe versus when Alzheimer's appears later. There is a genetic component. People do carry one or two different genes that would suggest, if the genes are present, that you are at higher risk for developing it, but not everyone carries these genes. It's believed that there are the main problem is, or what Alzheimer's disease is doing, is a direct impact on the central nervous system. It causes certain types of cells to atrophy or wither away, if you will. And these tangles, if you will, and it's a type of amyloid, a protein, begins to build up. And that is what's, over time, affecting communication within the central nervous system, and the cells are not functioning the way that they are supposed to. And over time, as I've said, it's really a destruction of certain types of cells and the neurotransmitters and memory that are associated with those cells. So it's quite literally killing off cells, but those cells are associated with memories. As I said, and here are some of the, there are some genetic mutations, if you will. Here are some of the alleles that could be involved. I won't test you on what the actual alleles are. However, I will reference the fact, or at some point I may ask you, is it more common for Alzheimer's to develop much later in life? And the answer is yes. Can there be a genetic component? The answer is yes. It does not, however, guarantee that if you have it in your family that you will develop it yourself, but you could be at higher risk. Some of the, again, the course of the illness over time will be changes to the presence of neurotransmitters. There are some medications. I referenced some of them in the psychiatry.org info. There are some medications out there. Aricept is one. Razidine is another. These are really designed to act in some cases, for example, as inhibitors, to try to slow down the buildup of those plaques, the amyloid proteins that begin to create this patchwork around the cells that is also destroying the cells at the same time. You also see over time as I said, the more of the breakdown of cell structure, and that is the goal is to slow that process, but unfortunately it does not stop the illness. It can slow, the meds can slow the progression, but it doesn't stop the illness. I want to just spend a couple moments on these. So there are some other neurocognitive disorders. For example, one is Parkinson's disease. It is not the same as Alzheimer's or dementias in general. It is its own illness. Generally, some of the hallmarks of this are ability, for example, specifically movement. So over time, movement can become more rigid. The person loses some dexterity. So you begin to see changes in how they're kind of moving and ambulating around. It's believed that dopamine has a role here. That is a neurotransmitter. And over time, approximately 75% of folks with Parkinson's will at some point also show signs of dementia. But Parkinson's is not the same illness as dementia. they can co-occur. There are some other neurocognitive illnesses. This is chromosomal, Huntington's disease or Huntington's chorea. It is a rare disorder of the nervous system. It affects involuntary movement. So, and this will over time could lead, for example, to respiratory failure. Patients here can also develop dementia at some point. I will not test you specifically on Huntington's disease. It is inherited by, not by in terms of genetics, it's not inherited through the father, it's actually inherited through the mother. And it is a progressive illness. It is also, therefore, neurocognitive in nature, and it does lead to brain failure, if you will. Vascular disease is quite different than, for example, Alzheimer's. So this is really mini strokes that can lead to the destruction of parts of the brain. This can increase the risk of developing dementia, but it alone, vascular disease, is not a guarantee that the person will later develop vascular dementia. But these mini strokes can cause cumulative damage to neurons in different parts of the brain over time, and it's that increases the risk of the person developing vascular dementia. Again, when you think vascular, think of blood flow, and if the blood flow to different parts of the brain are decreased, that can lead to cell death, for example. I just want to briefly talk about head injury. So the incidence of head injury are actually quite high. Some of the common causes are, for example, automobile accidents, falls. Some sports have a higher rate of brain injury, traumatic brain injury. Specifically, football is a common example. Also, boxing. It is, in general, more common among men, and also people who are either much younger and then going into, say, early adulthood to middle adulthood. The incidence only of falls are generally higher for older people, but other types of brain injury that are caused by a direct injury to the brain generally are more common among younger people. For example, car accident, sports injury, concussions, things of that nature. So again, these are another type of brain injury, and therefore they are a neurocognitive disorder. There's amnestic disorders as well. These are due, and this is due to a brain injury, generally an acute brain injury. The person will lose the ability to create new memories for a period of time. So every day, as long as they're experiencing this amnestic disorder, this amnestic or anterograde amnesia, they're having great difficulty in making new memories. So it's almost as though every day is a new day. And then something that's quite different is retrograde amnesia, for example. So anterograde amnesia is different than retrograde amnesia. Retrograde amnesia, the person, when they sustain a brain injury, in this case, have great difficulty remembering things that have happened in the past, as long as the amnesia continues. There is also another type of amnesia, global transient amnesia. I don't have it listed here, but that is another example of another type of amnesia. It's something that I actually experienced once. It is not as uncommon as people think. It can come on very quickly. There are 2 or 3 things that can trigger it. You recover from it, but it is another type of amnesia that some people do experience. I just want to just briefly touch on some of the different treatments that are out there. So again, if someone does experience a concussion, for example, key recommendations are get them to a medical professional. Do not, if you know that they have sustained some type of a brain injury, as I said, like a concussion, for example, do not let them sleep. They need to be monitored. And unfortunately, that's how some people have lost their lives if they have sustained a concussion and due to brain swelling, for example, and if they then sleep, they often do not wake up. So it's important to react quickly if a person has sustained, for example, a concussion. Don't wait to see if it gets worse. You should get the person into treatment. Sometimes some types of traumatic brain injuries do require some rehabilitation. Folks might have to go to a type of rehabilitation services. They might have to receive physical therapy, occupational therapy. In some cases, it could include speech therapy. So it depends on the extent of the brain injury in this case. And some of the after effects of a traumatic brain injury can be permanent as well. And there is a range of treatments that are out there, and also a range of different health professionals that do specialize in traumatic brain injuries, or TBIs. I will include a couple of videos also about sports. I love sports, and I'm not in any way suggesting that anyone who plays sports is necessarily going to get a concussion. But there has been there's now good evidence to suggest that there are some athletes, depending on the nature of the sport that they play, as I said earlier, can be at higher risk. That's why you notice, for example, like the National Football League, that over the years, the types of helmets, the types of equipment that players use has really evolved to try to reduce the rate of traumatic brain injury that's experienced by players. So I hope you enjoyed this really more of an overview of neurocognitive disorders. Great chapter, and I look forward to you getting into it a little more.